So recently, the American Academy of Neurology, they said that there's limited efficacy for epidural steroid injections to treat chronic back pain, okay? So now they're saying that we should not be using the steroid injections that we know, and a lot of docs love to put them in there, for treating chronic back pain. That means that's pain that you've had for 6 months, longer than that. But where is it indicated? It's indicated for new onset back pain. So one of the most common things we see is sometimes, most famously, I remember seeing the quarterback, he's now retired, Tony Romo, but he suffered an injury during a football game, and so the way he got back the next week was they had to do an epidural steroid injection into his spine, so that way the pain that he was having in his back was relieved by them going in, and his docs put in steroid medication to calm the inflammation around the nerve. That's called an acute injury, because he had it immediately after getting sacked on that play. But now what if patients are having chronic pain? You've been having this for a really long time. Epidural steroid injections are not indicated in that setting, really. But here's what's weird about this whole thing. A lot of insurance companies actually require me, they tell me to do epidural steroid injections for chronic back pain before I can offer them a more definitive treatment like this spinal cord, this spinal cord stimulation. So we're kind of caught in this weird area where an insurance company will tell me you should do this, but in my heart I know, you know what, it's probably not going to help you. And so that's kind of where we're kind of caught between a rock and a hard place there. But it's just something to think about, because everything that your doctor offers may not necessarily help. But I always like to, in terms of full disclosure, I always like to tell patients, I'm offering you this. It's a minimally invasive procedure. Unfortunately, it may just be a hurdle that we have to jump across in order to get you your real treatment that you may need.